Bismillah ar-Rahman ar-Rahim. In this lecture, we're gonna discuss the melanocytic proliferation. In the previous lecture, we have studied among what we have studied, we have studied the histology and the anatomy and subcutaneous tissue. The epidermis was formed of basal cells, the brachial cells, granular cells, and finally keratin. Among the basal cells, there is specialized cells which are the melanocytes, or the melanin producing cells. Okay, here is a diagram showing the melanin producing cells, which produce melanin and give our skin its color. Okay, here is the diagram. These cells are the melanocytes secreting or producing melanin that deliver it to the surrounding and give our skin its color. Here is a microscopic picture of the skin of a dark colored patient. Here is excess melanin pigmentation in the basal layer through melanocytes. Okay, so this is the normal structure of epidermis containing the specialized cells which are melanocytes. Now we're gonna discuss the melanocytic proliferation. As in whatever organ or whatever cell, we have to study the benign proliferation and the malignant proliferation. Here, in cases of melanocytic proliferation, we will discuss the benign melanocytic proliferation, which is melanocytic nevus, and the malignant proliferation of melanocytes, which is melanoma. Okay. Okay, now we will talk about melanocytic nevus. What is meant by nevus? Nevus is called for birthmark in Latin. Nevus means in Latin birthmark. Okay, nevus, when we talk about a single lesion, when we talk about multiple lesions, we call it nevi. Okay, why we call it melanocytic nevus? Because nevus means birthmark. It is not specified to melanocytic proliferation only. We have another nevi like nevus sebaceous, like epidermal nevus. So we have to call it melanocytic nevus to be sure that this birthmark or this lesion is due to melanocytic proliferation. Okay. It is a benign proliferation of melanocytes. It may be congenital or acquired. The patient may be delivered with this lesion, or it may acquire it during early childhood and adolescence. Okay. There is something which is common in melanocytic nevi or melanocytic proliferation, which is called maturation of the melanocytes. The melanocytes, they are specialized cells. They are originated from the neural crest. It is characterized by maturation. What is meant by maturation? Maturation means that by time, the melanocytes decrease in size and become more spindled and migrate towards the base or the bottom of the lesion. Okay, so any patient born with a lesion or melanocytic nevus, after some times this lesion may be smaller in size or may even disappear and may lose their pigmentation due to maturation of melanocytes. What's meant by maturation of melanocytes? The melanocytes decrease in size by time and migrate from the surface of the lesion to the base of the lesion and become more spindled and lose their pigmentation. Okay. Very rare to the nevi to be malignant. Okay. The origin of this melanocytic nevus, it may be benign proliferation of melanocytes, so it is a neoplasm, or it may be a hamartoma. You know hamartoma from the general pathology? What's meant by hamartoma? Hamartoma is an abnormal mixture of normal tissue. Abnormal mixture of normal tissue in a normal situation. Okay, mixture of normal tissue in a normal situation. What's meant by these words here in melanocytic nevus? The melanocytic nevus is formed of proliferated melanocytes, but it may be accompanied by proliferation of the overlying epidermis. Okay, so there is proliferation of two types, the melanocytes and the keratinocytes in the epidermis. So some scientists call it hamartoma rather than a neoplasm. Okay, so the origin of melanocytic nevus, most scientists call it neoplasm or benign neoplasm or benign proliferation of melanocytes, but some are call it hamartoma because in some cases it may be accompanied by proliferation also of the keratinocytes in the overlying epidermis. Okay, here is a picture. See here, it may be flat. It's a hyperpigmented area due to melanin production. Okay, it is a well circumscribed. Here is it is a macule, no elevation above the surface, but here there is it is a papule or nodule according to the size. Also hyperpigmented, elevated on the surface. Here is no elevation on the surface, and here is elevation on the surface, depending on the location of the proliferated melanocytes, as we will discuss soon, very soon. Okay. Regarding here the clinical picture of melanocytic nevus, um, uh, as we said, it is a benign proliferation of melanocytes. It may be congenital or it may be acquired. If it acquired, it arises in young children and adolescents. Okay. What we have seen grossly, it may be a macule or it may be a papule area circumscribed, different in coloration from the surrounding here, with no elevation on the surface. But here, papule is elevation of the surface, maybe papule, mostly dome-shaped elevation. Okay. Melanocytes is a small, uniformly pigmented lesion. Uniformly pigmented lesion. In contrast to melanoma, which we discuss later, as being characterized by variation in the color. Variation in the color. The melanoma, the malignant counterpart of nevus, is characterized by being having variation in the pigmentation. But the melanocytic nevus is characterized by uniform pigmentation. All the lesions have the same color, not variation in the color. The nevus is a benign. Okay, have not you have as a patient have not required to excise this lesion and examine it microscopically unless we are worried about it. What is the clinical presentation we can see in a patient with a nevus that can give us information, bad information about this nevus? It may turn to malignant. Okay. Any nevus which is irregularly pigmented. Okay, if the nevus have irregular pigmentation, one part is dark brown, one part is tan, one part is reddish. Okay, so this lesion have to be excised and examined. Okay, so the signs that give us alarm about this nevus is first, irregular pigmentation. Irregular pigmentation, not a uniformly pigmented. Second, if there is increase in size, okay, as we said, the nevus is characterized by what? By maturation of melanocytes. Maturation meaning downward growth of melanocytes, and these melanocytes become smaller in size and more spindle in color and lose pigmentation. So any rapid increase in size, which is abnormal, the normal is that the melanocytes decrease in color. But if there is an increase in size, so this nevus should be excised and examined. It may be turn into malignant, okay, or if it becomes painful, okay, the painful nevus give us alarm also. Then, or if it bleeds, okay, or if it bleeds, or if it is itchy, okay, these are signs that give us alarm, and this nevus should be excised and examined. If it is itchy and painful, so it may occur, it may be exposed to inflammation or irritation. The inflammation and irritation causes dysplasia. Okay, so dysplasia may turn into malignant melanoma. So the lesion of melanocytic nevus is small, uniformly pigmented. Either no elevation on the skin, macule, or there is elevation on the skin, which is papule. Okay, but what is the alarm signs that give us alarm? What is the signs that give us alarm? That we should excise and examine the nevus. First, irregular pigmentation, then increase in size. The normal, that the melanocytes should decrease in size by time. If it is painful and itchy, if it bleeds, okay. We come to the microscopic picture of melanocytic nevus. Under the microscope, what we can see in a case of melanocytic nevus? The melanocytic nevus is formed of groups of cells or nests of cells or peaks of cells. Groups, nests, peaks of cells. They are formed of rounded cells, rounded or polyhedral cells, rounded or polyhedral cells with rounded nuclei, okay, and containing amount of melanin, maybe intracellular melanin or maybe extracellular melanin, okay. So the nevus under the microscope, we can see it, the nevus cells are groups of cells or nests of cells or peaks of cells formed of rounded cells with rounded nuclei and containing melanin. The melanin may be intracellular or may be delivered to the outside and extracellular melanin. Okay. Firstly, the early lesion of melanocytic nevus is called junctional nevus. What's meant by junctional? Junction means that the group of cells here is present at the junction between the dermis and the epidermis. So the group of nevus cells is present at the dermo-epidermal junction, So the groups or nests or sticks of cells, which is formed of rounded cells with rounded nuclei, present firstly in the dermo-epidermal junction, at the dermo-epidermal junction, dermo-epidermal. So they are called junctional nevus. In a case of maturation, as we called maturation, the melanocytes, as we said, migrate to the bottom of the lesion, okay, and become smaller in size. And there is a component of these groups of cells in the dermis here, beside the group of cells which is present at the dermo-epidermal junction. So it is compound nevus. Compound nevus. Compound meaning the two components are present, which is the first one at the dermo-epidermal junction and the second one at the dermis. So the two components are present, the dermo-epidermal junction and here the dermal component. So it is a compound nevus. By time, the dermo-epidermal junction component may disappear completely. Okay? The dermo-epidermal junction component may disappear completely, leaving only the dermal component only, which is present. And now the dermo-epidermal junction is not present. So it is called intradermal nevus. Okay, so it is called intraepidermal nevus. So the stages of melanocytic nevus. First, it may be present at the dermo-epidermal junction only. So it is called junctional nevus. Okay, when there is maturation and migration of the melanocytes towards downward, it may be a company of both the dermo-epidermal junction component and the dermal component, so it is a compound nevus. And finally, the dermo-epidermal junction component disappear completely, leaving only the dermal component, so it is called intradermal nevus. Okay? As we said here, the covering epidermis may show some proliferation and papillary projection, so some scientists call it hamartoma, as we said. So sometimes some scientists call the melanocytic nevus not a real neoplasm, but it is a hamartoma, proliferation of both the melanocytes and the keratinocytes or the epidermal cells, okay, at the epidermis. Here is a diagram showing the stages or the types of melanocytic nevi. Here is the epidermis, and here is the dermis, and this is the junction between the dermis and epidermis, which is dermo-epidermal junction. Okay. First, the junctional nevus means that the group of nevus cells is present at the dermo-epidermal junction. Okay, dermo-epidermal junction. So the melanin content is nearer to the surface, so the tumor, so the lesion is brown to black. Okay, brown to black, and it's flat macule. Going back to maturation, and the group of cells migrate from here, from the surface, to be downward here in the dermal components. So both components are present at the dermo-epidermal junction and the dermis. So it is compound nevus. The compound nevus is clinically lighter in color. Okay, lighter in color than the junctional nevus. Okay, because much more space present here between the surface and the nevus cells. By the way, the dermal component causing elevation of the surface, dermal component causing elevation of the surface, okay, because it's surrounded by connective tissue proliferation, okay. And finally, the dermo-epidermal junction disappear here, okay, and leaving only the dermal component, so it is an intradermal nevus, much more lighter in color than the previous two types, the junctional nevus and the compound nevus, or maybe flesh colored as the color of the normal skin surrounding. But there is elevation of the surface. It became dermal only, so it causes elevation بتزق السيرفس لفوق. Okay, بتزق السيرفس لفوق, so it is elevation of the surface only, So it may be present as papule or nodule. Okay. Okay. Now we're gonna talk about malignant counterpart of nevus, or it is a malignant melanocytic tumor that is less common than the other tumors in the skin, like basal and squamous cell carcinoma, but it is more aggressive. Malignant melanoma is the most lethal cancer of the skin. Regarding incidence, as we said, it is less common but more aggressive than basal or squamous cell carcinoma. Okay, is the most lethal skin tumor. It is related to skin exposure, okay, especially in fair-skinned individuals. The highest rate of malignant melanoma was reported in Australia because it has more sun exposure, and the individuals are fair-skinned. Okay. Regarding sites of melanoma, melanoma occurs in any structure lined by skin or squamous epithelial covered mucous membranes containing the specialized cells, which is melanocytes. Like it is more common in skin, in anogenital surfaces around the orifices, as we said, oral cavity, tongue, genitalia, anorectal area, esophagus, meninges, and juvia of the eye. As we said, that melanocyte is present in the skin, in the meninges, in the uvea of the eye, in the inner ear. So all these places are subjected to incidence of melanoma. Regarding behavior, it is an aggressive tumor with frequent distal metastasis and lymph node metastasis. The probability of metastasis is predicted by measuring the depth of invasion. As we said before, the epidermis do not contain blood vessels, but the dermis containing blood vessels. So any tumor reaching the dermis and reaching the blood vessels in the dermis, so it reaches the circulation and forming distant metastasis to other organs. Regarding gross and microscopic picture of melanoma, we have two phases of melanoma: radial pattern of gross phase and vertical pattern of gross phase. Radial, what's mean by radial pattern of gross? Radial means that the cells grow horizontally, okay, horizontally within the epidermis without invasion of the basement membrane. Okay, so the tumor remains in the epidermis only and do not invade the base membrane and do not reach the blood vessels in the dermis, so it is still non-invasive, or it is an in situ tumor. So the radial pattern of growth in melanoma is characterized by the cells growing horizontally within the epidermis without invading the base membrane. No angiogenesis, okay, no metastasis. The malignant cells do not reach the blood vessels in the dermis, so no reach of the circulation, so no metastasis. Clinically, the tumor is flat or macule, different coloration, growth of melanoma cells or malignant melanoma cells in the epidermis without invasion, so it is a flat lesion. We know from the nevus that any dermal component causing elevation on the surface forming nodule or papule. But if the growth is still in the epidermis only and do not invade the dermis, so the lesion is clinically flat or macule. Okay, we said two phases, the radial pattern of growth and the vertical pattern of growth. The vertical pattern means that the tumor cells grows downward, okay, grows downward and reaching the dermis. In radial pattern, it grows horizontally inside the epidermis without invasion of the basement membrane. But in vertical, the growth is downward. Okay, extension from the epidermis to the dermis, to the deeper layers of the dermis. So if it reaches the blood vessels in the dermis, so doing metastasis. So they can send metastasis to other organs. Clinically, it is a nodule. Okay, clinically, it is a nodule within a flat lesion. It starts as radial pattern, the epithelial, the malignant melanoma cells starting horizontally, then spread to the epidermis, the dermis, sorry, and making a nodule. So it starts as a macule, then forming a nodule. So clinically, the vertical pattern of growth is characterized by being a nodule within a macule, or a nodule within a flat lesion. Okay, so this is the nodular melanoma. The nodular melanoma is a nodule. Okay, this is the vertical pattern of growth within a flat lesion, or within the radial pattern of growth, which is spread horizontally. This is a picture here of malignant melanoma. We can see here that the periphery here is flat surface. Okay, this is a macule. Okay, or flat surface, no elevation of the surface, or radial pattern of growth. And here is a nodule, or the growth is being extended to downward to the dermis, forming a nodule. Okay, and there is variation in pigmentation. Okay, variation in pigmentation. In contrast with the nevus, which was uniformly pigmented. All of the lesions have the same color, but in malignant melanoma, it is characterized by having variation in color, okay, and irregular outline, not well circumscribed. Here is a diagram showing the patterns of growth of melanoma. Here is the radial pattern of growth. Here is the dermis. Okay, here is the epidermis, and this is the dermis. This is the epidermis, and this is the dermis. Okay, and this is the subcutaneous tissue. This is the epidermis. Okay, the blue one here, and this is the dermis, and this is the subcutaneous tissue. In radial pattern of growth, the growth is horizontally. Okay, horizontally. No invasion of the base membrane here. No invasion of the base membrane, and no cells reaching the dermis. Okay, so the lesion in radial pattern of growth is in situ, or inside the epidermis only. But here, in vertical growth pattern, or in vertical growth phase, there is extension of the malignant melanoma cells downwards, okay, downwards into the dermis, So it's forming a nodule here, and the component is both epidermal and dermal, okay, epidermal and dermal. This is the vertical pattern of growth, and this is the horizontal pattern of growth. Horizontal, no invasion of the dermis, and this is vertical with invasion of the dermis and invasion of the basement membrane, so reaching the blood vessels in the dermis and making distant metastasis. Regarding the gross picture of melanoma, melanomas are normally larger than nevi. Okay, larger than nevi. The nevi was small, uniformly colored lesions, okay, and circumscribed. But here in melanoma, it has an irregular border, not well circumscribed, irregular border, okay, and there is marked variation in pigmentation, in contrast to the nevus, which was uniformly pigmented. Okay, but here is some different colors. Here blue color, black color, and a brown color, but the nevus is uniformly pigmented, one color. Regarding the microscopic, you can see here, as we said, melanoma has two phases, radial pattern of growth and vertical pattern of growth. In the radial pattern of growth, or the in situ phase, the melanoma cells appeared as groups, malignant melanoma cells or malignant cells appearing as poorly formed groups of cells or poorly formed nests at the dermo-epidermal junction without invasion of the dermis, only inside the epidermis or at the dermo-epidermal junction there is malignant cells. Okay, the malignant melanoma cells appears as poorly formed groups of cells. In contrast with the nevus, the nevus cells the grows in nests or groups, well-formed nests or well-formed groups of nests at the dermo-epidermal junction in case of junctional nevus. But here in situ phase of melanoma or the radial growth pattern phase of melanoma, the malignant melanoma cells grows horizontally inside the dermo-epidermal junction as poorly formed nests, okay? Only in the dermis, only in the epidermis and no cells in the dermis. Regarding the vertical phase of growth, the cells migrate downwards in the dermis, forming dermal nodules. Okay, forming dermal nodules. The melanoma cells are large cells, okay, with large nuclei and large nucleoli. Okay, the malignant melanoma cells are large rounded cells with large nuclei and large eosinophilic cherry red nucleoli. Okay, the nucleoli of melanoma are very characteristic. Here is the nucleoli, the cherry red eosinophilic nucleolus. Okay, the cherry red eosinophilic nucleolus of the melanoma cells. Okay, so the melanoma in vertical growth pattern are characterized by irregular groups of cells of large rounded cells with large nuclei and large eosinophilic nucleoli. Okay, these cells looks like epithelial cells, so we call it epithelioid appearance. Epithelioid means like, so epithelioid appearance. Or it may be spindle cells, so we call it sarcomatous appearance. Okay, so we call it sarcomatous appearance. Here is the spindle cells. The melanoma is characterized by different shapes. The cells may be epithelioid, maybe sarcomatous, maybe whatever cells. Okay, so in real life, we have to do immunophenotyping to be sure that these cells, which look like epithelial cells, are really melanoma. Because in some cases, we know that melanoma produce melanin, but in some cases there is amelanotic melanoma. A means no production of melanin. Okay, so to be sure that this is melanoma, we have to do immunophenotyping. Okay, so the melanoma groups regular groups of cells with large rounded nuclei, large cells with large nuclei and large nucleoli, cherry red nucleoli, eosinophilic nucleoli. This is the epithelioid appearance. Here, this is very characteristic, the eosinophilic large nucleoli. Okay, or maybe spindle in shape. Okay, or the cells may be spindle in shape. Okay, as we said, in the horizontal phase of growth, or horizontal in situ phase, the melanoma cells forming poorly formed nests at the dermo-epidermal junction or it may be seen scattered in the upper epidermis, but no cells present in the dermis. Okay, if it reaches the dermis, so it becomes invasive melanoma or nodular melanoma. Okay, here is a picture of melanoma. Here is the groups of cells, irregular groups of cells present at the dermo-epidermal junction. With the dermo-epidermal junction, and the few cells scattered also, not only forming groups, but maybe single cells scattered inside the epidermis. In the vertical phase, melanoma cells forming dermal groups or dermal nests. Okay, here is the dermal groups in melanoma. Not in all cases we can see the melanin here, the brown pigment here, which is melanin. Not in all cases. Usually, as any foreign reaction, any foreign cells, which is malignant cells here, the host will react. So we can see a band of lymphocytic infiltration, denoting a host reaction. This is not only for melanoma, but any other tumor in the body. The body react against it, trying to get rid of it, and forming lymphocytic infiltration. Okay, we can see it in the colon, we can see it in the breast. So we have to comment on the lymphocytic infiltration in melanoma. In whatever tumor, we have to comment on the lymphocytic infiltration. This is reflecting the host reaction against this tumor. This is the pictures, microscopic pictures of melanoma. We can see here the epidermis, and inside it there is irregular groups of cells, large cells here, and it reaches also the dermis, and here is the lymphocytic infiltration. Here is the lymphocytic infiltration, denoting the host reaction. Okay, here's the melanin pigmentation is a little more bit not apparent, but here is another melanoma. Okay, with much melanin production, which masks the melanoma cells. I cannot see details of the melanoma cells because of excess melanin production here. Is epidermis, and inside it the groups of malignant melanoma cells, and here is the dermis, the connective tissue dermis here, and here is also the malignant cells masked by the excess melanin. Okay, and